It's phenol peel time, my friends. So, beautiful older woman, you can see she's got a lot of sun damage and spots. She's got some loose skin, and I bet you she's gonna get a phenol peel. Let's take a peek at it. So here's her doctor removing that skin. And that, yes, that was her previous skin there. So in this video, we're gonna cover all about phenol peels. Did you find that video to actually be satisfying? Watching that hardened, sloughed skin just be removed from her face? Is that satisfying or is it disgusting? So this is the actual peeling process where phenol, which essentially is an acid called carbolic acid, is applied to the skin. And you can see this is how his skin progresses throughout the healing process. And this is many days to probably 1 to 2 weeks afterwards. It's pretty crazy. This is before, and here he is after. So the phenol peel is the most aggressive of chemical peels, and it goes deep, deep into the skin. There are light chemical peels that you can do that are what we call lunchtime peels, where it just exfoliates the upper layer of skin. You have it done at a lunch hour, you go back to work afterwards, and you look and feel fine. There are moderate depth chemical peels that go deeper than that, and the skin can peel for several days to maybe up to a week afterwards. And there is the phenol peel, which is considered a deep chemical peel, where you can really go through that process where your skin just hardens into this thick, hard mask, and then that can take upwards of 2 weeks sometimes for that mask to be removed. Now, when you undergo a phenol peel, the doctor has to literally peel a quadrant of your face at a time, taking about 15 minutes between sections that they peel. And here we are removing that mask of skin on this woman. Oh, here we go. Satisfying or disgusting? Some red skin afterwards. So if a doctor peels more than a quadrant of the face at a time, that phenol is actually cardiotoxic. It can cause an abnormal beating of your heart called an arrhythmia, and those arrhythmias can theoretically even be fatal. So phenol essentially is a poison that you're applying onto your skin. Some of that poison will be absorbed through your skin into your bloodstream, and the doctor has to give the body time, the liver and the kidneys, to detoxify it and remove it from the body. If the doctor is overzealous and applies too much of this to the skin, then you may get phenol toxicity, and this, once again, can be very dangerous. So why would somebody then undergo a phenol peel when there are other options like laser treatments? Well, you can see this woman's got a good amount of sun damage to her skin. She's got some wrinkles. She had the peel, and now he's peeling it off. So phenol peels are really good for people who have a lot of sun damaged skin. They've got a lot of wrinkles that they want to improve, and or they've got severe acne scarring. These treatments, although they are quite horrifying to watch, can be very, very effective in smoothing the skin. And essentially, it's like a reset for the skin for some of these patients. But in addition to the actual process being painful and then having that mask develop on your skin and having to basically walk around with that for up to 2 weeks, you can see afterwards the skin is very, very red. So here's an example of somebody who's got severe acne scarring. And really there's no other great treatment for this. You can do fractional lasers, you can do moderate depth chemical peels, and none of them are going to do what a phenol peel would do for her skin. You can see her skin does look quite a bit smoother afterwards, but it is beet red. Now, this redness can persist for several months. Most doctors tell their patients that the whole chemical peeling process of a phenol peel is around 6 weeks recovery, but that redness can last much, much longer than that. So as you can tell, I'm not a huge fan of phenol peels. They're kind of scary, honestly, and I don't do them in practice. So what would I do instead? Well, take a peek at this video. This beautiful young woman is undergoing a controlled depth or a blue peel. And this is a peel using TCA, trichloroacetic acid. This is a moderate depth chemical peel, not a deep peel like the phenol peel. And this one is usually very well tolerated. We do this in our office all the time. We don't need anything other than some topical anesthetic. And we also use a handheld device that blows cold air at the patient's face. And that can make this peel fairly comfortable and definitely tolerable. So what about the recovery of a TCA peel? Is it as bad as a phenol peel? Well, take a peek at this woman's 7-day journey after a 15% TCA peel. Initially, the skin will harden into a little bit of a mask, nothing like what you see with a phenol peel. But as you can see, after about 5 to 7 days, that skin starts to slough off and peel off. Now, the good thing about a TCA peel, like the controlled depth peel, is that there's absolutely zero pain in the recovery. Unlike a phenol peel, you don't worry about getting a potentially fatal arrhythmia if you're having it done. And the risks of the peel overall are much, much less than a deeper chemical peel. So if you've got overall aging of the skin, you've got fine lines and wrinkles, you've got sun-damaged skin, my recommendation, instead of a phenol peel, is to do a TCA peel like the controlled depth or the blue peel. If you, however, have really severe acne scarring from when you were a kid and you've done multiple treatments and nothing has helped, then a phenol peel may be a reasonable option for you, but make sure you see a doctor who has a ton of experience with this, because this is not a type of peel that you want somebody just dabbling in with your face. Now, if you're somebody who finds these phenol peel videos really satisfying, then you gotta take a peek at my previous phenol peel video up here, where we see a lot more of these where people are removing that mask of skin from their face. It is dramatic and it's honestly pretty cool. Take a peek at it right up here, and remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.